Want to welcome to the program right now from Doctors for Responsible Gun Ownership. Our friend Dr. Timothy Wheeler is with us. Dr. Wheeler, how are you, sir?
I'm good, Cam. Thank you for having me on.
It is my pleasure. You had a great column at the Washington Examiner this week on medicine's shameful silence on silencers, talking about how medical organizations are staying silent or some cases expressing outright opposition to the Hearing Protection Act, which could save the hearing of millions of gun owners around the country.
Well, that's right, Cam. And this, as an ear surgeon, an ear specialist, I'm retired now, but when I was in practice, I saw lots and lots of people with noise-induced hearing loss, including a lot of shooters, people in law enforcement, military, and just hunters and just regular shooters out there who had permanently, irreversibly lost a lot of hearing, and it was totally preventable. So increasingly, it has become unacceptable to me for our medical organizations to not only not endorse suppressors and the legislation that would deregulate them, but to remain completely silent on the whole issue.
And I got to tell you, Dr. Wheeler, as somebody, and I talked about this a little bit, my wife had to undergo chemotherapy late last year and early this year, and one of the side effects was this horrible ringing in her ear. She literally just went to the audiologist today. She's been trying to navigate this for the past couple of months, and she's suffered, chemotherapy-related hearing loss. She got fitted out for 2 hearing aids today, and having watched what she's gone through over the past several months and knowing what is ahead for her, it's not like the hearing aids are going to, take the ringing in her ears away. That's permanent. It's always going to be there. It's just a matter of dealing with that. And you must have seen so many of these cases that must have broken your heart. It boggles my mind that you've got medical professionals here who know damn well that this is not an assassin's tool, that this is going to reduce the decibel level of a firearm about 30 decibels. So it's still going to be awfully loud, but it's not going to be at the level that could cause permanent hearing damage. It boggles my mind that you've got people who are choosing politics over their patients.
And that's exactly what they're doing, Cam. Oh, first, my best to your wife, and I hope she does well.
Thank you very much.
American medical organizations have a moral duty to prevent disability whenever and wherever they can. And the frustrating thing is that with suppressors, they have an opportunity to hit a home run by supporting suppressors in their educational programs. That wouldn't cost them a penny because they already support earplugs and earmuffs for shooters. And also by supporting legislation like the Hearing Protection Act and the Shush Act recently introduced that would help make these suppressors more available to the American public. But for the most petty of reasons, they won't do this, and it's a moral failure of American medicine. I have actually talked to some of the leaders of these organizations, and it is clear. I mean, I was informed by a sympathetic person, actually, at the top leadership, that the opposition was based entirely on their animus against gun ownership, against their prejudice against gun ownership. You're talking about a very simple and a not very attractive type of bigotry here that's at operation at work in the highest levels of American medical organizations, and that's why they won't support suppressors.
Because if they did, that would be seen as as being pro-gun, right? This is something that the quote-unquote gun lobby is pushing, and so they it sounds to me like they automatically can't support it.
That's right. It's just a reflex. Anything that the so-called gun lobby supports, and in this case, it is a very noble cause, they're going to automatically oppose. It's just a really frustrating thing, and I think that the reason that they're remaining silent on it is because they won't say anything about it. They won't issue any public announcements about it or take a position on it, respond to media requests, nothing, and because they know that they're in the wrong on some level. I will say this, the message has gotten out from a medical organization, and it's your local friendly Doctors for Responsible Gun Ownership. The medical organizations on the national level wouldn't step up on this issue, so DRGO assembled 4 board-certified ear, nose, and throat specialists to write an easy-to-read paper on noise-induced hearing loss and how suppressors help prevent it. And 2 of our authors are actually fellowship-trained neurotologists who treat nothing but ear diseases. So you got top-level, national-level experts on ear diseases having written this brief article. We've sent it to legislators. It's available to the public and the media. The legislators have really appreciated it. It's linked prominently on our homepage at drgo.us. So I invite our listening audience today to check it out.
Absolutely. Dr. Wheeler, listen, thank you as always, sir, for coming on the program, and thanks again for your continued efforts here, and I hope you continue to speak up.
Thank you, Cam.
Absolutely. Dr. Timothy Wheeler from Doctors for Responsible Gun Ownership, drgo.us.